So I just want to look at the different planes first. The first plane is the sagittal plane, which divides the body into equal left and right halves, and has a frontal axis of rotation that runs medially and laterally. The next plane of axis is the frontal plane, which divides the body into anterior and posterior halves, and has a sagittal axis of rotation that runs anteriorly and posteriorly. The last plane is the transverse plane, which divides the body into superior and inferior halves, and has a vertical axis of rotation that The first joint we will look at is the shoulder joint and the two movements abduction and adduction. The first upwards movement that you see is the abduction, which is the movement of the humerus or femur in the horizontal plane away from the midline of the body. The downwards motion is the shoulder adduction, which is the movement of the humerus or femur in the horizontal plane toward the midline of the body. Both movements use the vertical axis. Next, we will look at the lumbar spine. The movement I'm doing is the lateral flexion, which is when the head or the trunk move away from the midline in the frontal plane. This movement uses the sagittal axis. We will now look at the shoulder girdle. The two movements I'm demonstrating are protraction and retraction. Protraction is the forward movement of the shoulder girdle in the transverse plane away from the spine, and protraction is the backwards movement of the shoulder girdle towards the spine, which is also in the transverse plane. Both movements have a vertical axis that runs superior and/or inferior. Here I'm demonstrating the knee flexion, which is the bending movement that results in a decrease of angle in a joint by bringing the bones together. The knee flexion is in the sagittal plane with a frontal axis. The knee extension is the straightening movement that results in an increase of angle by moving bones apart in the sagittal plane with a frontal axis. Here I'm demonstrating the medial and lateral movements of the hip. The medial rotation is a rotary movement around the vertical axis of a bone toward the midline of the body. The lateral rotation is the rotary movement around the vertical axis of a bone away from the midline of the body. Both of these rotations use the transverse plane. Tensegrity is a three-dimensional structure consisting of members under tension that are touching, and then there are components that are under compression, and those components are not touching.